This is the brain. The brain is the boss of your body. It runs the show and ultimately controls just about everything you do. The brain has the basic functions needed to sustain life. However, if the brain were to be interrupted, severe or life-threatening damage can occur.
So one instance of an example where the functions of our brain are interrupted is when a stroke occurs. A stroke is when our brain is severely deprived of oxygen. This can be either due to a blood clot blocking the flow of blood or to a hemorrhage. Despite the cause or the area of the brain affected, consequences can be severely life-threatening if it is not treated properly. We read an article that showed us that new nurses are undereducated about the management of stroke as they enter into their practice. With that being said, and stroke being the 5th leading cause of death in the United States today, we felt that it was crucial to educate our fellow classmates about the management of a stroke before they go and enter their practice as new nurses. Let's go, Rangers!
Go Rangers! Come on, go trip! Woo! Yeah! Here comes! Bing! Oh, here's the ball! Dude! We get the ball! We get the ball!
Get that, John!
Get it! Oh!
What was that?
Dude!
What happened?
Arm's like tingling.
Rangers!
What?
It's weird.
Alright, come on, Ray. Well, what are you doing?
I can't move my arm that much, man. It's like tingling.
Maybe it's just fell asleep or something.
No, my leg, dude. It's tingling down there, too.
What?
What is happening?
It's never happened before?
No, it's tingling, though, man. Like, it's just hard to move.
It'll be fine. We'll watch the game.
No, like, it's
Maybe
tingling a lot.
Can y'all be
What?
quiet? I'm trying to
It's tingling.
What's wrong?
John, are you
See,
okay?
man.
John.
What?
I think
It's
I need to
tingling.
go to the doctor.
Okay, okay, alright, John, let's
Good.
go. We need to go to the
Good.
ambulance, okay? I think we need to call the hospital. Here.
You better get into the
Alright,
hospital.
come on, John.
Yes,
Let's go.
That poor man.
It's gonna be okay, John. They'll take good care of you.
Hi, how are you doing?
Hi, I'm with Transport. This is John, and his brother brought him in today.
Hi.
Okay, let's go ahead and get you on the table and then we'll have an assessment. Okay. Can you
Able to
stand?
Yeah.
Okay. Okay, can you scoot back? There you go.
Maybe scoot back for us.
Okay.
Okay. What was your name, sir?
My name's Lewis.
Lewis.
This is John.
And you're his brother?
Yes.
Hi, John. How are you doing today?
No.
Not so good. Are you able to talk to me? Can you understand what's going on? Kinda. Can you tell me your name?
John.
John? What brought you in here today, John? Okay.
We were at the baseball game and he started to feel tingling in his hand. I didn't think it was a big deal, neither did he. And then it started to go to his leg. And then all of a sudden, when we were about to leave the game, he started to not be able to talk right. It was like real lispy and
Some slurred speech.
yeah, it's just real funny.
Have y'all been drinking?
He had a few beers, but I mean, he doesn't get like this when he drinks usually.
Okay, let's do a quick assessment on him and we'll figure out what's going on, okay?
Okay, thank you.
Can you squeeze my fingers bilaterally? Both hands as hard as you can? Okay, there's a little weakness in this right side. Can you lift up your legs? See if you... Okay, this one is droopy. Can you lift your arms straight out in front of you? Okay, yeah, I think he might be having a stroke. I think we need to call a stroke.
Okay. Coach Stroke! This is John. He's having some slurred speech, some right-sided weakness.
All right, John, can you squeeze my hands?
We think it might possibly
You guys
be
think
a
it's
stroke.
symptoms?
Yeah.
Can you put your arm up? All right, so definitely some weakness in that arm. Can you tell me your name?
John.
John. All right, so when did these symptoms first start occurring?
Probably about an hour ago.
An hour ago. Okay, so you guys remember the rules for TPA, so we got to get that administered within 3.5 hours. So this is a medication that basically, if it's a clot that's causing the problem, we're going to administer that and hopefully get this taken care of. So our next step, we're going to need to get a CT scan, which is like an imaging study. It's going to take a picture of his brain, and it's going to kind of tell us a little bit better of where this stroke can be located. So basically a stroke, it can be due to a bleed or to a clot, and it's going to deprive his brain of oxygen. So that's why we're ultimately seeing these symptoms now. So it's just really important that we get this taken care of fast so that we can get it treated and all of that good stuff. So your nurses here, they did a really good job of getting it getting him assessed fast. So what I'm going to do is we're going to have someone come and take him to CT, and you guys give him some aspirin now. Has he had any bleeding in the past couple of months?
No, I don't think so.
No head trauma, car accident, injury?
No.
Okay. So I'll get a more thorough history from the brother as after he gets up to CT. We'll take care of that. So let's start him with an aspirin. They're going to come. We're going to get him to CT, and then hopefully we can administer that TPA. Really good job on that rapid assessment. All right, so we're going to take good care of you.
Okay. Thank you very much, Doctor.
I'll be back.
Have you had any history of this in your family?
Not stroke.
Hello, I'm
or
Dr.
not
Guerrero. I'm
just,
here to do
just,
the CT scan to
hypertension.
see if there's any clot.
Okay. Are you gonna transport him?
Yes, I'm going to consult with Dr. Smith and see what's the plan of care, and then we'll try to do if we need the TPN or not.
Okay.
All right.
So you said there was a history of high blood pressure.
Yeah.
Does he take medication for that?
Yes.
I'm gonna go get the aspirin.
Okay.
Since the order's then, okay?
Okay.
So, is there any other histories in your family that we should know about?
No. I mean, there's nothing that. I mean, nothing like this has happened before.
Okay. And he doesn't take any other medication?
Not that I know of.
Okay. So the other nurse is going to get your aspirin right now, and as soon as we administer your aspirin,
I have your aspirin for you. There you go.
What is he taking that for?
The aspirin's going to be a blood thinner, so it's going to help thin the blood, so that way it could help get blood back to the brain. And we're basically doing this prophylactically, so that way before we get the CT, at least before we start a more aggressive treatment, then the blood flow will start going back to the brain, okay?
Okay.
There you go. Here now.
Yeah.
Thank you, John.
All right, so did they answer most of your questions?
Yes.
All right, so CT transport's on their way right now.
Okay.
We're going to get him up to CT, and then we'll go ahead and start that more aggressive form of treatment that I discussed earlier and that they've also discussed, okay? We're going to take good care of you, John. All right, so the nursing process: assessment, diagnosis, planning, intervention, evaluation. This is something that we've been killed and drilled on all throughout nursing school. But until we put it into action and into the actual clinical situation, do we know how we're actually going to perform? Are we going to be able to meet our patients' needs? In this scenario, we wanted to demonstrate how the nursing process was used to help diagnose and then ultimately treat a stroke patient. So what we wanted to focus on was that a fast and efficient and accurate assessment by our nurses is critical in the diagnosis of a stroke. This means that as graduate nurses, we have to be educated about the symptoms and pathophysiology of a stroke as well as the treatment. We hope this video helped you guys to get a better understanding of what stroke treatment in the acute phase looks like and what we will do as new nurses out in the clinical setting.